friend. Welcome to another episode of the show. I have Dr. Rachel Brown on this time. So, Rachel is a psychiatrist in Scotland, and she's also the book of Metabolic Madness. So, we start by talking about how metabolic health is, of course, really important to mental health. You could tell that from the title. But Dr. Rachel has recently become a quantum health practitioner colleague of mine. So she is being trained through the Quantum Biology Collective and is wrapping up that certification. And so she talks a lot about how she's incorporated the quantum health in her own life and how that's been helpful. And then what that's looking like in her work. So, Rachel has one foot in the traditional psychiatry world, still working in the hospital setting, and one foot in consultation, helping people all over the world in consultation. So, she's a wealth of information. She's a lovely human being. So, I think you're going to really enjoy this conversation. But at the end, we talk about toxins in our environment. And so that's really important piece too. In fact, I'd really like to have Dr. Rachel back on to talk more about that. But I hope you enjoy this episode as much as I enjoyed talking to Dr. Rachel Brown. Rachel, welcome to the new show.
Wow, yeah, thank you for having me. It's a
Yeah, I'm
pleasure
so
to be here.
excited to have you back. I was going to say back on, but you were on the Nourish Soul podcast. We had a great episode and we talked a lot about metabolic health as it relates to mental health. And I think I'd love to start there anyway, because I know people can go back and listen to that episode. People know
Mm.
you because of your book,
Oh,
Metabolic
okay.
Madness,
There it
right?
is.
Like,
Okay.
there it is. But I still think it's a good place to start. And then I thought maybe we could talk a little bit more about how quantum health has entered the picture these
Mhm.
days. But why,
Sure.
I don't think people realize, like, why is metabolic health so important for mental health?
Okay. Oh gosh, big topic, isn't it?
It is a big topic.
Where to start? I quite often just think about depression and anxiety because it's such a
Mhm.
common issue. There's so many people suffering from it. But when you look at the research, and I know the research literature has its flaws, but there's so much out there that just shows a clearly overlapping connection between poor metabolic health and the risk of experiencing depression or anxiety. And so if you have a diagnosis of depression, you're more likely to have a diagnosis of type 2 diabetes, even subsequent to the depression, and then vice versa. So if you have type 2 diabetes, you have higher rates of all different mental health disorders as well.
Yeah,
So
and I don't know about you because I know in traditional psychiatry, you went the traditional route. But I think
yes.
for me, like it took me a while to really I made the connection, I think personally first,
Mhm.
but then really realizing like I knew nutrition was really important, but there wasn't a lot I felt like I could do with my clients, especially when I was working in a hospital setting or these settings where you had to follow what they tell you you have to do, sort of the more traditional
Mhm.
path. But also, I didn't quite really make the connection between anxiety and diet. It took me a while and my own experimenting with my own diet to realize, oh, this is really actually helping me. And then kind of making the connection. And I think for a lot of clients, it's still really hard because they don't want to give up a lot of the things that really create a problem for their metabolic health that is also creating the problem for their mental health.
Yeah, I know, absolutely. I mean, I was just speaking to a lady the other day who I hadn't met in person before I saw her that day. And I'd looked at some of her blood results before seeing her, and there wasn't anything really jumping out at me in terms of her being metabolically unhealthy until I went into the room and saw her face to face. And I thought, oh, okay, yeah, you've definitely got metabolic syndrome, even though it's not very obvious from your blood results. And she's somebody with lots of anxiety at the moment, but also cognitive type issues. So developing a few memory problems. And when I asked her what she was eating, the first words out of her mouth were, "Oh, I've had to change my diet recently. It hasn't been good." But basically, cakes, sweets, chocolate, bread. And then we just had a conversation about the close relationship between good metabolic health and mental health. And And she seemed really surprised about that. And she's on various medications that aren't really helping either. So it just struck me as a fairly obvious potential solution.
I know, and I we could go in so many directions here with the medication route and how
Yeah.
people get put on these different medications and the
Mhm.
memory, and it's not just about like depression and anxiety, bipolar, all the mood disorders that really do improve if you improve your metabolic health.
Yeah.
Also, memory, cognition, I
Mhm.
mean, dementia, all of those kinds of things. And the
Mhm.
research has been there. I mean, the
Mhm.
research is pretty clear. It's
Yep.
just taking a while to trickle down to people. And it's not just the cakes, right? I think there are a lot of people who think, "Oh, well, I know how to eat." I've had so many clients say to me, "Oh, I'm a healthy eater. I know how to eat healthy." And you're looking at them and you're saying, a lot of them might metabolically actually look healthy, but when
Mm,
they talk
can.
to me about what they're eating, it's it's actually not health it's what they people think is healthy food. Lots of fruits and vegetables, out of
Mhm.
season stuff from a package, a lot of gluten, and I just
Mhm.
like caffeine, gluten, things that with hidden sugar, a lot of processed stuff that they're not thinking is processed, like spaghetti sauce and things like that,
Yeah.
you know?
Yeah. Yep.
Um, and so they're just not they're not realizing, like,
Mhm.
what we're
Yeah.
talking about.
Yeah, I mean, there was absolutely no emphasis in my training or subsequent continuous professional development about the impact that food or nutrition can have at all in terms of brain health, mental health. And in fact, a lot of the information out there we know is pretty terrible anyway, in terms of the standard information. So,
That's true, which makes it really I get it that why people are so confused and
mhm.
why people don't know where to start. So if you have someone like that, well, first of all, when you look at her, what are you seeing that's like, "Oh, there's definitely some metabolic health issues here." Like the puffiness, the
Yeah.
swollen, what do you see?
Yeah, I mean, typically central obesity, so people with sort of the wrong waist to hip ratio, so lots of
Yeah.
carrying lots of weight around their middle. Um, there have been other people as well with really high blood pressure and those kind of issues that tend to go along with metabolic syndrome. But yeah, I guess usually you would hope the person might be aware that they aren't all that satisfied with their body composition. So sometimes people will say to me, but yeah, it's usually central sort of fat accumulation.
It's the tall, thin males that are always really surprised. Like, their blood work will often be all, wacky, and so you can
Can
see
be.
it in the blood work. So
Hmm.
sometimes people's blood work looks great,
Yeah.
especially a lot of females, like, I'll see their blood work looks great, but they're actually really puffy and holding a
Hmm.
lot of weight in the middle. But these tall, skinny folks will often what is it, toffee? Like,
Yeah.
thin on
Then
the outside, fat
side
on
fat
the
on the
inside.
inside. Yep.
Not that, we don't wanna shame anybody here, this is not
Mhm.
the purpose, it's really just about an awareness.
Yeah.
But when you have that going on inside and it messes with your metabolism, but also your gut health is off, and
Mhm.
when your gut
Yeah.
microbiome, the microbes in and around that we carry on us, but mostly the bacteria, when that's off, then you're almost guaranteed to have some mental health issues. It might be mild, it might be severe, but
Mhm.
there's a definite connection between the gut axis and the brain axis.
Oh, for sure. So in fact, I had a patient very recently with bipolar disorder who had a major relapse, and it was someone who'd done really well using a ketogenic diet to manage her major mood symptoms. But for various reasons, she fell off the wagon. And then she also has a diagnosis of Crohn's disease, so an inflammatory bowel disorder. And actually, when she was more severely unwell in the last few months, her inflammatory bowel disease was also off the charts in terms of inflammatory markers and bordering on needing admission to hospital for immunotherapy, something she just did not want to do. And luckily, we managed to get her back on keto. And I followed her up a few months later after she was better. And she came back to see me and she was doing great mood wise, no longer depressed. But actually, what she was super excited to tell me was, look up my blood results, look up my blood results. And her calprotectin level, which is a marker of inflammation in the gut, had gone from 600 odd down to less than 25 being within the normal range and without any intervention medically.
Yeah.
So I think that's just a really powerful illustration of the clear gut-brain connection that there is. And
Clear. Yeah. And I think just important to reiterate to people. Also, I had clients come with Crohn's, IBS, lots of IBS, all of
mhm,
those kinds
yeah.
of things. Some of them became because they had anxiety as well. And some of them came because they just thought they had gut issues. I love when people are like, no, my mental health is great. And you're like, wow, you're actually one of the more anxious people I've ever met. But okay, if
Oh,
you
wow.
think so, totally fine. Not that we put diagnosis on people if they don't want
Mhm.
it.
Yeah, yeah.
But I think that was one of the first people that I saw as a nutritional therapist was somebody that came that had Crohn's and anxiety. We were kind of really just working on the anxiety, but the Crohn's, she had a colonoscopy within the time we were working together and no signs of Crohn's. Like literally nothing there. Her
Wow.
doctors were really shocked. And all she was doing was nutritional. We were using some supplements too, but she just really embraced nutrition and did the work. And for her,
Mhm.
it was absolutely no gluten, giving up caffeine. I think she had already done that by the time she got, because most people with anxiety realize the caffeine is not helping
Yeah.
them.
Yeah, yeah.
Right, but a lot of people don't realize gluten, and, she had it was 0 sugar. I mean, no honey, no stevia, no nothing, and was really disciplined about an animal-based way of eating, lots of healthy fats, moderate protein, low carbohydrate. So, not necessarily in ketosis, but
Okay.
certainly a low carbohydrate diet,
Mhm.
and yeah, completely in remission from Crohn's.
Yeah.
So
It's, yeah, it's amazing, isn't it? And the patient I was referring to, I know for a fact that she's been to see the GI specialists and also her own psychiatrist that she sees and has raised the question um, about the connection between going keto and improving both her mental health symptoms and her GI symptoms, and has been completely dismissed on both counts
I
on
know.
several occasions now. So
But that's
it's
what's so
pretty.
sad and disappointing.
Hmm.
Like, come
I
on,
know.
it's so apparent. The research is clear.
I know.
It's like it's not like we're coming out of left field anymore on
No,
this.
even
So
though it feels that way sometimes.
it does. And I mean, and I was even thinking I'm going with my mom to the doctor next week, and I was like, do we tell them I've put her on ketogenic diet? Do I bother with that? But I think the reason to do that is one to be you just keep telling it to your doctor, like, "This is what I'm doing," and especially if they're seeing improvements, like, hopefully that rings it'll ring true for them, but also the med management, because you and I both do a lot of consultation, and so you want people to see their prescribing provider, and they have to be able to manage because they can come off of some of those medications.
Yeah, for sure. Yeah, I one of my real frustrations in psychiatry, it particularly relates to people with bipolar disorder because the research is absolutely crystal clear there in terms of we know that more than 50% of those people with that diagnosis will have insulin resistance. And yet, a lot of the drugs that they're put on cause insulin resistance as well.
Yeah.
And when they have insulin resistance, the clinical outcomes are worse. It leads to neuroprogression in bipolar disorder and a deteriorating course. And there's a lovely research from Cynthia Colkin clearly showing that people with persistent symptoms, if they can reverse the insulin resistance, they also restore response to treatment and can put symptoms into remission. And yet I'm still encountering, a lot of colleagues and so on who just don't seem to have any awareness of that. And so I get people asking me questions about what's the best medication or what's the least offensive medication to be on for bipolar. And I just always say I'd really rather avoid atypical antipsychotics or probably antipsychotics in general because of the clear association with insulin resistance and type 2 diabetes. But it's not very well known, sadly.
Yeah, it isn't. Yeah, so most of the people who come to you are what? What's going on with them? What symptoms do they have? They're reaching out to you because they want to
Okay.
come off medication or they're
Yeah,
trying to avoid it.
Generally, I would say most people I speak to either haven't had much success trying lots of different medications, or they've ended up on a whole heap of drugs and have various side effects, one of which is weight gain, metabolic dysfunction, type 2 diabetes, and then they're still symptomatic several years down the line. There are a few other people who just want to avoid medications. But certainly in my private work, it's been people frustrated, I would say, with um, just not having ideal outcomes.
Yeah, and mostly with a bipolar disorder or
No, I get all sorts of different diagnoses, people that I work with. It's just I run a group for bipolar disorders, and it's often the research in relation to metabolic health and bipolar that first comes to my mind. But yeah, no, I've seen all sorts of different people, lots of depression, anxiety, schizophrenia, even a whole host of different
yep,
issues.
all of it. Yep, got it.
Mhm.
Yeah. And when people come to you, how open are they to changing their diet?
I think the population who come to me are fairly self-select. So usually people are either open to making changes to their diet or they have already tried quite a lot. And then we're maybe troubleshooting because diet hasn't been enough on its own.
Got it.
So
Yeah,
there's a
which
range.
is, yes, exactly what I get because diet can make a huge difference.
Hmm.
And so
Yeah.
before we switch to more of the quantum health, because I think that's where we're
Yeah.
headed, is that
Yeah.
that's what I also was like, well, here's this whole nother realm because when you've changed
Hmm.
diet, that usually takes care of a lot of things. But then there's
Hmm.
all this other piece of the puzzle, which is the quantum health strategies and
Yeah.
really being in harmony with our natural environment that people don't seem to we just don't know yet. But people it's spreading, right?
Yeah.
But before we do that, like, when somebody comes to you and they actually haven't changed much of their diet, do you start them on a ketogenic diet? Is it more like what I do is more individualized where we have to see
Yeah.
where they are and what they're willing to do?
Yeah. That.
But are there certain things that you're like, okay, this, and this have to go?
All right. Oh yeah, for sure. So I would absolutely say get gluten out of the picture, get rid of seed oils, definitely.
Yep.
Um, I suppose ideally I would want people to try and veer towards keto, but if they're not so convinced about that yet, just starting off a paleo type diet would be an
Perfect.
ideal first step.
Yeah, yeah.
Yeah.
Same page. Yeah, you and
Yep.
I are definitely there. And do you have people come that are vegetarians or vegans, and what do you do about that?
Not really all that many. So I'm trying to think. There probably have been a few, but I get quite a few former vegetarians. So some people who are maybe just transitioning out and then they want some advice around
Mhm.
taking a lower carbohydrate approach and completely changing what they're doing.
Mhm.
Having said that, I probably in the NHS more I see people who are vegan, vegetarian, and I do try to mention to them some of the downsides or how it wouldn't necessarily be ideal from my perspective.
Right, just in terms of the nutrients, even from a
Yeah,
nutrient deficiency perspective, and never mind all of the other things, but just from getting certain nutrients that it's really
yeah,
difficult, if not impossible, on
yeah,
a vegetarian or vegan diet. So, particularly vegan. Yeah, that was just a personal, like, I don't know. For me, I've just started being really upfront that,
hmm,
I work with an animal based ketogenic mostly, but an animal-based
hmm,
way of eating for people, so I might
yeah,
not be the right fit for you.
yeah, yeah,
Yeah, it's like,
yeah,
love you, but don't think we're gonna be a good fit. Okay, so then we've done all the stuff with diet. So talk to
hmm,
me about quantum health because last time you were on the podcast, you were just starting to kind of dip your toe into the
hmm.
quantum health space. And I was like, you are going to love this. It's going to be so much. And you really have embraced it personally, it looks like to me
Oh
from,
yeah.
yeah.
Yeah, I mean some people might think it's a bit extreme what I do now, but I'm just absolutely sold on it and
Mhm.
pretty consistent myself with getting up, getting sunrise and trying to get out for light breaks if I'm in my NHS work and can't manage those exact times and get the UVA rise and block artificial light after dark and I'm into grounding and sauna and Even things like intention and gratitude and all that side of it as well.
Were you doing the intention and gratitude and mindfulness work before you came to quantum health or not really?
Um, I was a bit so more gratitude. I think I'm trying to remember time scales. I think quantum and sort of gratitude practice probably coincided, but I think I was already doing a bit of gratitude before I got into the quantum stuff, but not on such a big scale.
Right. And was that ever mentioned? Was any of this mentioned in your traditional psychiatry training?
No, no.
No,
And I
no.
mean, I was just reflecting on this morning. In fact, I was speaking with my mom and I was saying the majority of people I see, certainly within mainstream services, are
Mhm.
sleeping in half the day, never getting up and seeing any morning light, on their phone screens, so blue light toxic the rest of the day into the evening, complain that they can't sleep, and then are just expecting a pill to be able to sort all of that out. And it's no wonder we just don't see the results that you would hope to see from standard treatments, especially if somebody's not doing the lifestyle piece as well as trying different medication strategies. So,
Mhm.
yeah, it's incredibly frustrating.
Yeah, it really is.
Some people just don't want to hear it, do they?
I know but until they do, until they get like just
Mhm,
like, okay, I'm tired of being so tired. I'm tired of feeling awful and the side effects from the medication, like whatever it is that gets people to go, okay, I'm just gonna open myself up to
mhm.
whatever this weird quantum stuff is that I keep hearing about. If it keeps coming to you, it's probably worth looking into, right? But for you, like, what do you feel like was the biggest shift? Did you start with light? Did you start with earthing? Gratitude was coinciding, but
Yeah. Oh, I started with light,
yeah,
definitely.
yeah.
So I got into earthing relatively late on because I remember seeing people doing it on social media and thinking, what on earth is that about all about? And it wasn't until I looked into it myself that I thought it opened up a whole new world of research. And
Mhm.
that has been one of the biggest game changers for me personally, I would say would be the earthing. Although I'm not necessarily comparing that to doing the whole light piece. It's just I'd been doing the light stuff for much longer, and it was just very much part of my routine anyway. But I don't know how you found it, but my quantum journey has been that I almost feel painful when I'm exposed to artificial light, or if I find myself in a situation where I don't have my blue blockers. It just I think your body's sensitivity and awareness changes over time. And I feel similar now to if I don't have many opportunities to ground. So it's been incredibly cold here recently. The ground's been completely iced up and frozen. And my routine would normally be to do a bit of work in the morning and I would go outside and do it just grounded in the garden. But there was a couple of weeks I just wasn't able to do that. And it's hard to explain. I just really felt it in my body.
Yeah, and
My,
it is a little it's hard to explain because it can
mhm,
almost feel a little nuanced too if you're
mhm.
doing all the things. But
Yeah.
when you've been doing something for a while and then you add one of the practices like earthing, literally
Mhm.
skin touching earth, if people are like, what are they saying? She's saying it differently than she's saying it. Like we're talking about literally putting our skin on Earth's surface. So it could be grass, dirt, sand, rocks, touching a tree, touching a bush, as long as it's planted, actually, not in a pot. But concrete, even as long as
Mhm.
it's not painted and it's not asphalt or rubber, it will, if it's conductive. So that's what we're talking about. And you can literally feel it. I can literally feel it. It's
Mhm.
virtually instantaneous that we're
Mhm.
absorbing those
Mhm.
electrons through our skin,
Yeah.
but I can feel it in my nervous system. And you're right.
Mhm.
If you somehow are not able to do it for a while for whatever reason, you crave it. Your body
Mhm.
starts to
Yeah.
crave it. And you can even start to get some symptoms that you
Mhm.
maybe just lived with beforehand that you thought was just part of life.
Yeah. Yeah.
And
Yeah.
then, and then you're like, well, that's actually my body needs to be touching earth.
Mhm.
Yeah.
Yeah, absolutely. Yeah, yeah, you explained it much more eloquently than I did there, but yeah, I agree.
Nope, that I just know
Absolutely.
that sometimes people are listening and they have no idea what we're talking about. And I think light is how I started too. And
Mhm.
light made a huge difference, but I think it's just where I was willing to start. Somebody told me,
Mhm.
"Go out at sunrise, like, it's just important for your health," and I was like, "Alright." And so I started making a point to at least open the door and stick my head out
Yeah.
into morning light. Even if I couldn't get out there right at sunrise or any of that,
Yeah.
it's totally fine. Just
Mhm.
get some morning light,
Yeah.
and we always say, natural light before blue light. So before you look at a
Mhm.
screen,
Yeah.
get some natural light.
Yeah.
How open are your clients to hearing this stuff?
Generally fairly open. I'm probably thinking more about my private one-to-one
Yeah.
clients, or group clients. So the people who've sort of self-selected into really wanting to make a change and motivated to do something about their health problems. As opposed to the more NHS people I would see. But they're everybody's different. So there are handfuls of people who are interested, and then others who kind of give you a bit of a funny look when you mention it, and you say maybe go and do your own research on it. Um,
Yeah,
yeah.
for sure. When you talk, have you noticed anything? Like, I'm really interested in motivation. Like, what actually gets people to make change? And as a psychiatrist with a lot of experience and now adding all this other holistic, more types of stuff,
Mhm.
is there anything that you see that some themes around who's motivated and who's not motivated?
Um, I mean, I think it generally just comes down to somebody being really willing, but also desperate in some ways to change because they've suffered so much.
Yep.
So it comes down to suffering and not having had good answers from all the things that they've tried to date. And sometimes that has been going through the functional medicine route as well. So I had somebody this morning actually I spoke to, and they contacted me. This is what I love about quantum, because there's so much more that you can do when you view things through that lens. And it was someone who'd been through multiple functional medicine specialists in the past and NHS and all sorts of stuff. And they'd sent me lots of information for my intake form, but they hadn't mentioned any testing in the past. And I happened to ask, I said, I'm not one of these functional medicine doctors who's really hell bent on testing everything. I was just wondering, have you done any tests? And they said, oh, I've done everything, multiple times. And I said, was there anything that stood out from that or changed things for you? And they stopped and reflected and said, well, actually, not really. There wasn't, despite all those tests. I looked at spreadsheets and I spent quite a while obsessing over different results and so on, but it didn't really move the needle forward in terms of my health. And I thought that was really interesting. And actually, we just spoke about quantum strategies, and a lot of it they hadn't been aware of. And I'm pretty sure it's a mineral deficiency that this particular person has issues with, and probably dehydration causing histamine intolerance, those kind of issues. So, yeah.
Amazing.
Hmm.
So one, it's the motivation is when you're desperate, and
Hmm.
being miserable and suffering
Yeah.
is definitely a motivator. But also, I think you're exactly right. Some people just don't know. They haven't been
Hmm.
told, but there's
Yeah.
something about the people who keep seeking. And it is, I think, when you still are just, you're not meant to feel awful all the time.
Hmm. Yeah.
And it's like, this can't be right.
Hmm.
There's got to be a different way of being, and I would just say to anybody out there that's listening, there is. Don't give up.
Yeah, for sure.
The
Yep.
pieces of the puzzle, if you keep seeking, will come together. And I am, for one, used to be a very anxious human being. And I just thought, well, I'm a type A person. That's just how I am. I do not live that way anymore. Like, I have to work to conjure up that much anxiety that I used to walk around with all the time.
Wow. Yeah.
So, and it really, all the things have been helpful. So all the
Mm.
traditional stuff and a lot of the mindfulness and meditation, gratitude, practice, all of that was helpful. I did all of that. I even did deep shame resilience work. And none of it
Wow.
moved the needle like the quantum health. Nutrition
Hmm.
first, that definitely
Yeah.
made a big difference. And then the quantum health strategies. I just didn't know
Yeah.
that my the light environment was affecting
Hmm.
everything.
Yeah. Oh, for sure. And then you look at, I'll try not rant, but hospital environments are just not places to heal,
Please
really.
do rant. Yes, I know.
Certainly in terms of light environment and non-native EMFs and all of those and the food, everything. It's
Everything. And it's
hmm
like you're supposed to be there to heal, and it's one of the
I know.
least healthy, and I remember
hmm
feeling that way. I mean, one of my first jobs in counseling was at a psychiatric hospital for children.
hmm
And yes, they had rec therapy and outdoor, but a lot of it was so unhealthy that it just I couldn't put my finger on it, but I was like, this is not the place to heal. Hey, I just wanted to jump in real quickly since we're talking about anxiety in the show. If you are somebody who experiences chronic anxiety, I wanted to let you know about my new course, Anxiety Recovery Course, The Light Method. We are utilizing my method in the 7-week course. It is all pre recorded. It launches February 16th. So you can get in there and go at your own pace. And it is not obviously replacing therapy or consultation, but extremely helpful in putting all of these pieces together. So if you're listening to this episode and you're thinking, these are a lot of pieces, and how do I put that together in my own life? The course can be super helpful. So I invite you to head over to anxiety-recovery.com. You can see it in the show notes. Just click and check out the new course, Anxiety Recovery Course. I hope to see you there. Take care, friend. I think
Yeah.
there are people who work in environments where it's like, look, this is my job. So maybe we could talk a little bit about, if you're at work before sunrise and it's hard to take breaks, and how do you manage that when you're doing the more hospital work?
Yeah, so I've taken to wearing yellow lens blue blockers during the day in the hospital because
Yeah,
the lighting's just atrocious. Yeah,
there we go.
something like that, yeah.
Yep.
And yeah, it's funny, every so often I'll get a patient who makes a comment about it, but I think I felt a bit self-conscious in the beginning, but I think colleagues just sort of get used to it and nobody says anything these days, or only occasionally, but I just don't care, to be honest with you, because I just think it's so essential. And I just try to nip out, even if it's just for a few minutes, to get some natural full spectrum light on my eyes, even if it's after sunrise. So once I've finished a meeting, I just go out for a few minutes, and then I just try to get out as much as possible during the day. And if I can make the UVA rise, then that's great. But it's definitely different to the days that I have off, or if I'm working from home, that kind of that
Mhm.
schedule would be different.
Mhm. And
Yeah.
I don't know where you are in Scotland. Do you have all the biohacking tools? Are you into the earthing mat and all the things, or are you just mostly just try to do everything natural outside?
Yeah, so I have an earthing sheet on my bed.
Mhm.
Um, and I know there are mixed opinions and different views on those, but I was measuring my heart rate variability at the time when I got it, and I definitely noticed an improvement in that for myself. So I figure that was quite a positive intervention for me. So yeah, I'm into that. I'm into cold plunging.
It's a
All
good
of that,
thing to
although
do where you are.
yeah, yeah, absolutely. Although I've been a bit naughty and I've missed it very recently, but I keep refilling it in the hope that I'm going to get in someday soon. But I absolutely love that when I do it, and I think that can be a great intervention for the right person as well. In terms of just trying to get into a rest and relaxation nervous system state and managing anxiety or an intense, like ruminative thoughts, even if it's cold enough, it tends to shut those thoughts off, doesn't
It
it?
does, it will take care of that. There's also a zing. I don't know if you get a zing in your brain afterward.
Oh, yeah.
The
Oh, yeah.
zing is I mean, I know it's like the dopamine hit, or,
Yeah.
all the good chemicals being released, but I think it's the light.
Oh,
Honestly, I
amazing. Yeah.
believe it's the light that we make inside of ourselves
hmm
that is
Yep.
really powerful, and so I get that metabolic health is really important. I
hmm
get that gut health is really important, but nothing has really literally lit me up in terms of my profession as much as learning that we make our own light, and the
hmm
light outside of us is influencing the light inside of us. And I'm like, if we can
Yep.
tend to that light, so many things improve.
Yeah,
including mental health.
absolutely. Absolutely. Yeah, when I first started cold plunging, I think I put a reel on Instagram just saying it was just my own personal reflections on the experience and how I thought this would be incredibly powerful as an intervention for somebody with anxiety because it completely shut off any thoughts that were going on in my mind. And I'm probably guilty of staying in there too long and wanting to push it longer and longer in terms of the sessions that I do.
Oh,
So sometimes I have to be careful about that. But
yeah.
yeah, yeah,
I do not have that
love it.
issue. I'm
Yeah.
like 2 minutes. I can do 2 minutes. I
Oh,
can't do a second more than 2 minutes at the
oh, right.
moment.
I was up to about 12 when I was doing it before, I think. And
12
like
minutes.
you don't need to do it for that long, but it was just it is a dopamine thing. So I
It
think
is
it could be addictive in another way.
It can be addictive. I
Mhm.
haven't gotten to the point where it's addictive, but I think it's interesting, people who
Mhm.
push the limits
Yeah.
on things in our personalities,
Yeah,
and
yeah.
we push. So
Yeah,
anyway,
yeah.
really funny. I think
Yep.
that's an amazing tool for people cold in general,
Mhm.
not
Yeah.
necessarily cold plunging, but just
Yeah.
cold exposure
Absolutely.
and being able to, and I don't know about you, it's not very cold here. So
Okay.
it's just not that cold here. But I used to be cold in 70-degree weather. Like I
Right.
was a girl that was in fleece when everybody else was hot, and I was like, no, I just don't have that kind of sensitivity anymore. I'm not
Mhm.
freezing. I'm not too hot or too cold. I just adapt because of the circadian rhythms being so supported. I just adapt really well to whatever's happening outside.
Mhm. Yeah, absolutely. It does get easier the more you practice it and your body does adapt. Like we're designed to.
Like we're
Uh,
designed to.
yes.
I know that's
Yeah.
yeah.
Yeah, I was just when you were talking there, I was thinking there's nothing more disappointing from my point of view when the weather's a bit milder here, and I go out to the cold pod, and then I think, oh, it's not cold enough. And yeah, I don't know if you found this, but it doesn't work as well for me unless it's very cold because sometimes I get that accessory muscle shivering, and then I think, oh, I'm going to get out because it's not really doing what I want it to do. Um, with activating the sort of brown fat tissue. But anyway, maybe that's
Oh, the brown, yeah, the brown fat.
too high level.
No, you know what though? I think that's really interesting that
Mm.
you go there. I think because of the science part of it, like you
Yeah,
almost can't help but go to what's actually happening. For me, I'm
yeah.
just trying to stand it for as long as I can. Like I'm still in that zone. But
Yeah,
it's
yeah.
amazing how many things that I thought I could never do or that were really hard at first just aren't that hard anymore. And
Oh, yeah.
that's one of them. Exercise, I recover so much quickly now. I was always like, my neighbor really, she got me running last year. And I was like, no, no,
Mhm.
no, I'm not a runner. And now I'm the one that's like, hey, let's go. I'm ready to do 3.1 easily. So it's just amazing, like the recovery piece of it and
Yeah.
also the energy.
I've got a really high energy dog who's a bit crazy at times. And I can't remember if it was last year or the summer before. I just decided, right, I'm going out to run with you, like work off some energy. And I hadn't been running for a long time. But I distinctly remember a memory from when I was at school. A couple of friends and I used to pick to go like on the running group instead of doing field athletics. And it was always so hard going. And so if it was a year ago or 2 years ago, that's several years into carnivore and also doing some of the circadian practices. And I went for like a 40-minute run with my dog, and admittedly she pulls, and so she's a bit like a husky. So I got a bit of help going up the hills, but I just realized when I was running around that, I feel this is easy and I feel pretty amazing doing this. And this is easier than when I was 16 from what I remember. And how can that be? I'm in my 40s now and I wasn't expecting this to be, anywhere near as simple as it actually is. And anyway,
Right.
yeah, it's mind blowing.
Yes.
Mhm.
And I think just from an energy, well, and to not live with chronic anxiety anymore for me is just
Mhm.
unbelievable. I thought I would always have at least some because I have. Even on carnivore, I still had some anxiousness. I mean, I could become
Mhm.
anxious really quickly, easily. and I just don't anymore. It's
Yeah.
unbelievable that
Yeah,
in
that's
your,
amazing.
and I'm in my 50s now. So it's like you
Hmm.
don't
Okay.
realize like that it can get so much better as we
Hmm.
age. Not
Oh,
not
I know.
but better.
Yeah.
And for
Yeah,
you,
yeah.
go ahead.
I had a client this morning and he's a bit older than me and he's been carnivore for 2 or 3 years now. And he was just saying he feels better than he did as a teenager in his 20s, and he'd suffered for decades with all sorts of health issues, and he just can't believe the difference that just changing his diet has made from that perspective. So yeah, yeah,
It's
I believe
amazing.
it. Hmm.
And for you, I know not everybody's going to go over to YouTube and see like how creamy, beautiful your skin is.
Oh,
Were you
thank you.
afraid of the sun, or was that
Oh gosh, yeah. So
okay?
I was a chronic sun avoider all through my teens and my 20s. In fact, probably I don't know that I was such a sun avoider, but I definitely wasn't somebody who would sit and sunbathe until I got into all the quantum stuff the last couple of years. And so I have so much regret, is all I can say, about the pasty white skin that I've had my whole life. Like I remember my dad actually when I was a teenager joking that I would put on factor 50 and then sit in the shade. It was that bad. It
Mhm.
was that bad. So we've been given so much bad information. Yes.
Yeah, and it was because of information. It wasn't
Hmm. Oh
okay.
yeah.
Yeah, you're
Yeah. I think I probably had a couple of memories of having been a bit burnt when I was a child, and peeling, and I just didn't like that.
Mhm.
But it was mostly about the information. And in fact, it started off for aesthetic reasons. So um, I'm sure when I was a teenager, I started putting SPF on my face because I'd read somewhere in a magazine that if you do that, it'll stave off wrinkles. And so I just started this thing where I was definitely putting it on around my eyes from the age of, I don't know what, probably 13 or 14. And again, did that until the last couple of years.
Yeah.
All that toxic stuff I used to put on my skin. Yeah.
But you really do have lovely skin. And so I
Thank
just
you.
want people to know that you can love light, natural light, be
Mhm.
outside and do it safely. Yeah, all the I was never a sunscreen person and I
Oh,
always
you're
felt really
lucky.
guilty. Well, now, but I felt guilty that my kids, I, really didn't put it on my kids either. And so now I'm like, yes, me. I was helping my kids. I wasn't actually,
Yeah,
we
absolutely.
just didn't worry about it that much.
Yeah. I remember being on holiday in America years ago and
Mhm.
seeing somebody and they had their baby outside in the sun, like no nappy or anything. And I remember thinking, oh gosh, that baby's getting so much sun. And now I look back on that and think, oh wow, that was so healthy for them. And then I have regrets about my own son, and I'm sure I didn't do things right in terms of getting enough outdoor light with him. There's a lot you reflect on when you have better information and you suddenly see the error of your ways.
Yes, but
Hmm.
all we can do is look forward now with the
Yeah.
information that we have. And how are you open? Because it seems like a lot of psychiatrists are kind of closed. Not, I'm not going to blame
Mhm.
psychiatrists, a lot of people.
Yeah.
But, what was it that kept you open enough to keep? Is it the research that gets you? What is it that,
Mm. Um, I mean, I'd known for a long time that we'd been lied to about food. Or I was going to say been given bad information, but I'll go on further and say been lied to. And it's the last 4 or 5 years that just completely switched me on and opened my eyes to everything else. So I've been down many rabbit holes since 2020, let's just put it that way. And I'm very grateful that I didn't lose my critical thinking ability, despite going through mainstream medical training and education. And because yeah, if any colleagues ever listen to this, they'll be annoyed with me, but I don't see a huge amount of critical thinking going on. And I think I'm probably just somebody who's always been interested in the why. Like I like to know the reasons for things, and I can't really remember sciencey stuff unless I absolutely understand the whole process and why it happens. I can't just learn facts. I've never been somebody with a great memory for factual things. Like I didn't think history was all that fun at school because I just didn't like learning out of context facts. And Yeah, it's just like working from first principles and just having a good understanding of things, I think has helped.
Yeah, and I remember you saying that's why you wrote the book is really for you to put it
Hmm.
together. And then you
Yeah.
thought, well, this might be helpful for other people, but it's like I
Yeah.
need to understand the why and
Hmm.
have all the pieces, sort of the
Yeah.
big picture, and then also the components of that.
Hmm.
So
Yeah.
that makes sense that that's the way that you think. But I just think sometimes people, I'm surprised, I guess, at how closed off people
Hmm.
are to information that seems
Hmm.
absolutely crazy at first, but to
I think it's the thing that surprises me now is just how trusting people are of
the
authority.
lies, yeah,
Yeah, I mean,
well, yeah.
just accepting verbatim what government or other, organizations tell them. And I think, I'm guilty of having done that going through my training. So I just accepted verbatim what I learned for college exams and for my further education and never really questioned anything properly until more recent years. And then obviously my own health journey came into it. So I've learned things that way and seen other family members suffer and had to work out solutions for them. And, there's been a whole host of different reasons why everything has come together the
Hmm.
way it has.
Hmm. I think I'm grateful personally for the way that things have come together because
Hmm.
I wouldn't have kept looking if I thought I had all the answers. And now I realize you never have all the answers. This journey is never
Yeah.
over. We should always be,
Yeah.
and even when people are listening to this, don't take our words
Oh
for it
no, for sure.
for
Yeah,
sure. Yeah,
do your own research. Yeah.
yeah, and
Hmm.
experiment because there's nothing wrong with an N of one. If
Yeah.
something works for you and you want to experiment and try something out, then I think that's the
Oh yeah.
way to
Yeah,
do it.
definitely. Yeah, definitely. I'm a big believer in sort of bio individuality. So we all come from our own backgrounds and set of circumstances and different environments and different levels of toxin load and circadian disruption. And, um, and although there are broad themes that apply to everybody, I think people should be able to pick and choose and work out, a process for them and just try things out and then reverse decisions if one particular thing doesn't work out and maybe it's not the right time and you come back to it again later. It's just about being pragmatic about what helps.
Hmm. Being pragmatic and also willing to experiment, I
Well,
think.
yeah, curious. Yeah.
Being curious, yeah.
Yeah.
And I think curiosity tends to get really squashed with anxiety. So
Hmm.
I think, you got to come at helping people reduce the anxiety and probably depression and bipolar. I would say any of the mood kind of
Hmm.
disorders or mood. I
Yeah.
don't know if I call them disorders because all they are is
I know.
communication, right? That's such a weird
Yeah.
to say that it's
I know.
disordered.
Yeah.
It's totally ordered. It's
Uh-huh.
telling you exactly what you need to do. It's just hard
Yeah.
to hear it and to understand what your body is trying to tell you. So
Hmm.
once you start to get that to calm down a little bit more, then it's easier, I think, to have more
Hmm.
curiosity come back.
Yeah, yeah, I guess it's hard to have a lot of space to think if there's a huge amount of anxiety going on. But if you can get, interventions that give you little gaps or just opportunities to be able to think about things and plan, then that's definitely what can be helpful.
For sure. So what if
Mhm.
we not talked about Rachel that would be important for us to, is there anything that you really wanted to share? Or you think, oh, we didn't touch on that?
Um, Not particularly. I suppose I've had my own journey with mycotoxins being an issue, and so I'm really big on
Ah,
environmental toxins and how they can impact on mental health as well as general health. So it didn't manifest as a mental health issue for me, but I had various neurological signs and pain that I narrowed down and finally came to the conclusion that I was overloaded with a particular mycotoxin when I did testing. And so yeah, I like to take a sort of bigger picture view when I work with people. So just circadian and quantum stuff is absolutely foundational, and so is the nutrition. But then there's this third piece of the puzzle I often think of, which is about managing our environmental toxins. And some people just aren't as efficient at detoxing as other people. And but probably the biggest discovery for me personally was that I was easy water deficient, definitely. So
Yeah.
when I
Exclusion zone. Hmm.
as part of my protocol for trying to detox the mycotoxins that I had on board that were causing me major symptoms, I had a whole sort of binder protocol, but I started implementing sauna and a lot of sauna, and I really struggled with that in the beginning with what some people might refer to as Herxheimer symptoms, so detox symptoms, but actually just learning more and more about quantum biology, I've come to recognize that I was probably water, exclusion zone water deficient, and that's why I was experiencing those symptoms. Because I have no problem now, I can do really long sauna sessions, no bother. But I used to feel like I was going to be sick after the first few saunas, even when they weren't that long. So,
Wow, that makes a lot of sense.
mhm,
So yeah, environmental toxins, which we could go on and
mhm.
on and on
Oh
about,
yeah, I know.
right? Like there's a lot.
Mhm.
And what was it, mold or what myotoxins are
Yeah, mold.
with
Yeah,
mold? Yeah.
it was mold.
Yeah, such a bit important piece that often
Hmm.
people don't realize often does manifest in neurological issues or anxiety. And
Yeah,
never
yeah.
had someone that has mold illness that didn't
Hmm.
have anxiety.
Oh
Uh,
yeah, I've got a lady actually with OCD who's had it for 15 years and been through all the standard treatments, so lots of different antidepressants, therapy. Nothing's really made a huge difference. As in, she's improved somewhat over the years, but it's still very much symptomatic. And just one discussion with her about her history and her environment, and it was obvious to me that she has a major mold issue. And we did testing, and she was off the charts with mold toxins. And then I just thought, well, hey, can you expect any of those other things to help when your body's struggling with this mold toxin that can and does disrupt brain health and causes anxiety? So it'd be
mhm.
really interesting to see what happens with that over time once she
Yeah.
manages to fully sort it out.
Yeah, and I think
Mhm.
another really important, what I might call a healing response, detox, what we're talking
Yeah.
about is I think is really challenging at first. If you don't know anything about that and you're just like, no, I feel worse. I feel worse.
Hmm.
This feels worse. And if you don't realize that that's part of it, I think
Yeah.
there's something, and especially when people change their diet and they're like, this is hard, and sometimes they have keto flu or they
Yeah.
have some kind of other issue that's like if they've gone carnivore where they don't feel as good for a bit, but they can tell that things are improving
Hmm.
enough to keep at it. So
Yeah.
I don't know for you if the sauna in particular, if you could tell that it was helping enough to keep at it, or did you really need to then understand exclusion zone
Yeah.
water?
Do you know, to be honest, I was just so freaked out by the results I got on my testing because I was off the chart in terms of at maximum point on the measurement scale as well for a certain mold toxin.
Mhm.
And I just knew that the sauna was going to be essential for me to detox from it as well as the other strategies I was using. So I just kept going and persevered. And in fact, it helped me to take binders before using the sauna. And after that, I didn't have any of those detox symptoms, but I knew that I had to build up the sessions in the sauna and do it for a longer period of time to build up my exclusion zone water. And then once I'd done that sufficiently, I wouldn't be having the detox reactions. And then I just phased out the binders. And so I could just carry on. And sauna's just a pleasure now. It's an absolute pleasure to use.
Okay. Well, yeah, so that's really important, I think, for people to understand
Mhm,
too. Like I was committed.
mhm.
And
Yeah.
then you also knew that it was helping your exclusion zone water,
Yeah.
like
Yeah.
in the sauna. I think most people don't know. And if people are like, what
Yeah.
are they talking about? We're talking about the very special water inside of our bodies that our mitochondria make water, and then that water gets structured. And it's
Yeah.
often called exclusion zone or easy water
Mhm.
because it literally is an exclusion zone. It
Yeah.
excludes out anything that shouldn't be there. And it can get really depleted and we can be cellularly dehydrated.
Mhm.
And what pumps that back up, there are several things, but it's full of electrons, that water.
Mhm.
And so it's really helpful to have cellular hydration, to have lots of that exclusion zone water. And
Yeah.
infrared light expands it.
Yeah.
So
Yeah.
yeah. So the infrared in the sauna will actually help expand that exclusion zone
Yeah.
water.
I mean, I just think it's a fascinating topic. It's
It is, yeah.
the fact it can exclude non-native EMF and everything.
Anything
It's
that's
just
not supposed to be there, it's
yeah,
just
yeah,
not let in.
yeah.
It's amazing.
Hmm.
And it's everywhere in the body. So from
In the
head to toe,
brain. Yeah.
everywhere. And
Hmm.
so every biological service inside of our body has this water right next to it. So it's really helpful, I think, to start with light. I think it just makes I started with light, you started with light.
Hmm.
I think it's a little
Yeah.
easier to go, okay, how do I make sure I'm getting my light right?
Yeah.
And earthing, because earthing is also absorbing electrons, so
Hmm.
it's helping your exclusion zone water and your whole
Yeah.
body, your mitochondria. But then then you move to water, right? And I think
Hmm.
sometimes people could start with water, but we're mostly water.
Yeah.
Water holds memory,
Yeah.
all the things we start to learn, and it's a whole different rabbit hole.
Oh yeah, for sure. I was so lucky I managed to see Veda Austin on her book tour. She came to Scotland and it was just
Oh, nice.
phenomenal. So yeah, that's I always love telling people who don't know about it just to see their faces when I'm trying to explain. And I just say, I'll just go on her Instagram and have a page through. Your mind is going to be blown.
Your mind will be blown. Yeah, Veda
Hmm.
Austin is, well, she's just a lovely human being, but her work
Yeah.
is just
Oh,
fascinating.
it's phenomenal. Yeah.
And just how
Yeah.
smart water is. It's not just that
Hmm.
it has memory, it's actually it can interpret, and it's
Hmm.
just so amazing.
Hmm.
So not something that I've learned in my training, and not
Me
even
neither.
beyond, you and I both trained with Georgia Eid.
Hmm.
And
Yeah.
so even there, like I don't know, this is a whole different realm. You have to go
Yeah.
into quantum, the applied quantum biology and the emerging science to
Hmm.
really understand water.
Yeah. Yeah. Enough said.
And for now, we can do a whole
Yeah.
other episode on that. Well, yeah, I'm glad that you brought that up. So it's also the environmental toxins and what
Yeah.
could be holding up the picture. So
Hmm.
looking at the whole thing and the
Hmm.
nutrition and the quantum health strategies and all
Yeah.
of it, but also our environmental toxins. So thanks for bringing that up.
That's okay.
Yeah.
I don't think there's anything else I've thought of as we've been speaking. So
Okay. Well, I'm so glad that you came back came to the new show, came back to
yeah.
talk to me. I'm so excited to have you on. And
Yeah.
so, yeah, anytime you want to come back, we're happy to have you.
Oh, thank you. I'd love to. Yeah,
Yeah.
really enjoyed this conversation. So
Yeah. Always fun to talk to you, Rachel.
yeah, thank you.
Thank you.